think about your own health and also think about your near and dear ones, because it is not only about ourselves and protecting ourselves, but it is protecting overall all the people who are around us. And I am here to take you on this journey. Okay, so all right, let me talk to you about what is the biggest problem which is facing Indians today. So how many people are suffering from heart disease? There are some of the people whom I have with me over here, but the ones who do not know me think that the number one cause today is heart disease. Okay, then lungs and stroke. Stroke is your brain health, paralysis. Okay, infections. So I'm not getting into the details, but we are having what we call twin epidemic in India: diabetes and heart health both. Okay, so now if we look at the population, many people ask me that if you are a doctor, then why you have gone into preventive heart care and all these things. Now, the population of India is like more than 1.36 billion, and there are only 20,000 actually cardiologists. So the 10% of the people are actually having heart disease. Imagine. So even if all the doctors will work 24/7, we actually cannot face this endemic. I mean, whatever this epidemic of heart and diabetes. And that's why I'm so excited here today that what we are doing, people from any field, whoever has got a pure heart to help the people can be making a difference in the lives of the people in preventive care. Okay, so this is the huge opportunity what we have out here. And I have always resonated with this quote by Hippocrates, who is the father of modern medicine, where he said that let food be your medicine and your medicine be your food. In India, most of the people love Ayurveda, yoga. We have got a great ancient civilization. I believe that India is the spiritual bedrock, because we are always taught to meditate and believe in God right from childhood. And I love what the Western world has to offer, because they always teach you about the materialistic and the right guidance and the right activity and the right way to do things, because they are evidence based. So what I'm sharing here is wonderful because it is doing both. It is going to talk about what should be there in your food or what is missing in your food, and I'm going to bring in the evidence. So it is not something blind things which we are talking. And I also wanted to share with you that the nutritional knowledge is completely lacking currently in our healthcare system, because doctors are busy treating the symptoms and very less time for nutrition. So all of you should be made aware that what kind of nutrition should you be having so that you can take care of your health. Okay, and just a quick note that what I'm talking is of big concern, because today, like if I look at my practice 30 years back, I used to have people like 65, 70, 75 years of age. But today, the average age of my patients has gone down to 40, 50 years. Okay, because 50% of all the heart attacks are occurring under the age of 50 years. And this is something very, very alarming. Also, I am concerned about the women having heart problems nowadays. And we need to really address this issue with prevention. Now, one of the most burning question and the research which I want to share today with you is that, do you know that how COVID-19 impacts heart health even if you are a normal person without any heart disease? Okay, I'm repeating again, without any heart disease. Now, what is happening is that as this infection is growing and a lot of research is coming up with the cases, what they are finding is that people who are getting this infection, if you are in a pro-inflammatory stage, like, there is a lot of inflammation going on in your body, this virus is actually creating more inflammation response. And they found that after the infection, almost 78% of the people are getting some kind of inflammation on their heart muscles. After some time, 60% are still having some kind of damage on their heart muscles. Okay, so this virus has the capacity to go and affect your heart muscles, and we really need to understand what is inflammation, we need to protect ourselves, we need to fortify ourselves. And what I'm talking out here is going to like help you to build your defense better. Okay, as I told you that people are getting these heart problems in spite of we having so many high tech hospitals. Like even in now, India has also great hospitals. US and developed countries already had, and they found that when they did the heart attack studies, in almost more than 100,000 cases, they found that almost 75% of the people had normal cholesterol, as per the standards. So, what was the reason why people are getting heart attacks even with normal cholesterol? Like, even if we look at India, like half the population is vegetarian. Okay, many of them are not smoking, like what we call the traditional factors. They are not smoking, and but still, Indians are much more at risk for heart and getting at a younger age. So, what has been found out that the inflammation is basically the new cardiovascular risk factor. Now, I know I've been talking about inflammation, and there are a lot of this people who are saying, "What is this inflammation? ये inflammation क्या है? ये cholesterol सुना था, ये inflammation क्या है?" So let me just tell you that inflammation is a natural body process of repair and healing. Okay, when you fall down and you get hurt, your body has to repair itself. If there is an injury, so then there is some redness, some swelling, some pain, and your body repairs itself and you forget about it. Okay. But when there is a repeated injury, it happens again and again and again and again and again, then there is a problem for the body because there are a lot of factors which change, and I'm going to show what changes. So this process, what you're seeing here, the redness, the swelling, like all these things is basically known as a process of inflammation. And this is happening in each and every part of the body. Like imagine, like suppose if you have pain, you're having a joint pain, you're having a shoulder pain, you're having a back pain, you're having a headache, you're having a migraine. Wherever there is a pain, that is a sign of inflammation. So you may not be able to see it, but you are able to feel it many times. Okay. So what is happening in the cells that, so this is a normal cell which is functioning very well. This is the membrane of the cell where, the nutrients have to go in and do all the function. Like it's like each cell is like our mini body, like how we eat. If we have to eat well, we have to digest well, and then we have to pass out the waste products. That is our morning routine, right? So same way, every cell has the same thing, but like, that what happens if you cannot eat properly, you cannot digest properly, and if you have constipation, what goes wrong, right? You don't feel good. Similarly, this is what inflammation affects your cells. Chronic inflammation, your cell membranes are not good, and then all the problem starts. Okay, so what exactly is the one of the reasons which affects the inflammatory process is omega-3 fatty acids. Okay, so this essential fatty acids. What do you mean by essential? Essential means like you do not manufacture in your body. Okay, so you have to consume it from outside. The source is outside. That's why we call it essential. So essential fatty acids, they're found in fish oil, flax seeds, omega-3 fatty acids. Okay, so the three main sources are ALA, APA, DHA. Many of my people who are here know that I've always been talking about flax seeds, as a good source. If people can consume fish oil, it is very good because it has got DPA and EHA. So omega-3 fatty acids is something which is very, very good for brain, heart, and immune function. Now, omega-6 and omega-3 are two types of fatty acids, and it has been found that their balance is very important. Okay. Now, what are omega-6? They are again a type of fatty acid. Sources are vegetable oils, and consumption has drastically increased, and because of which we are having like a lot of imbalance. Okay, so what is the problem is that the ratio of omega-6 to 3 in the diet has become too high because people are taking less of omega-3. Okay, and omega 6 is from unhealthy sources. Now, what do I mean by that? To give you the local Mumbai thing is like your pav vada, your pav bhaji, all those things like keeping on frying your jalebis, your puris, your, like if you're Gujaratis, your puris and khakras, I mean that all that fried things and that same oil. And we don't know when we are buying food from outside, I don't know whether you have seen that pan actually of the people who are frying that vadas, it's all jet black. It's all fully loaded with free radicals and bad, this omega 6. Okay. So what has happened in the process that we are not consuming what is right for us. We are consuming what we feel is right for the palate, what we feel tasty. Okay. So, and that is not serving us. So when the omega 3 fatty acids are in a good proportion with omega 6, what has been happened is that they have done studies where there is reduced in the incidence of heart attack by almost 25%, which is great. And there is reduced in cardiac events, there is reduced in triglycerides. So when I found Zinzino, I was very excited that they have got a validated product which can help and benefit so many people. So research has also clearly indicated that the ratio of omega 6 to 3 is extremely important for reducing inflammation. Now, right from the beginning, I'm telling you inflammation, inflammation, inflammation. So reducing inflammation, but who is talking about it, right? This test which I'm going to share with you is not done in any diagnostic center. It is not prescribed by any doctor. You go and ask for this, you don't get it. So we are so happy and I'm so proud to be associated with Zinzino that they have put in efforts to enter the India market and offer this test to all the people over here, which I feel is really a blessing. I've been associated with Zinzino in US and I've closely seen their work, and I'm seeing that what they are doing is really making a difference in people's lives. So let me go more into it, that when you don't have this omega 6 to 3 balance or ratio, whatever, is your brain working well? Are you remembering things well? Don't think, oh, abhi main buddha ho gaya, abhi to yaddash jani hai. Don't think all those things, You have a right to age healthy, you have a right to live well. So that sense of complacency sets in, okay? And we tend to accept what is happening to us as an aging process. My dear friends, I want to let you know that you can die young, you can die healthy. There is no need to succumb to any disease or, be dependent on someone and have a poor health and live this body, okay? We have a choice. So check on your hair, heart function is one thing, check on your skin, check on your joints and muscles, if you have any of the issues anywhere, then I'm sure that there is an imbalance happening and a test is required. So the product which I'm going to share, which is about the omega 3, which is a good source, a pure natural source, it has got 18 health claims. Now look again on this very clearly. It improves your brain function, heart function, immune function, vision, teeth. It is good for the mothers, newborns. It helps in the bone, blood pressure, triglycerides. All the people who do the lipid profile, they know that in Indians especially, I have seen triglycerides is a huge problem. It should be less than 100, but most of the times it is on the higher side. Lowering and blood cholesterol, normal muscle function. So it has got, and most important is oxidative stress. Many of the people out here know that I have been involved in a lot of IV therapies which fights oxidative stress, and because oxidative stress is excess of this free radicals which goes and damages your cell. To give a simple example is that when you cut an apple, it becomes brown, okay, if you leave it. But if you put some drops of lemon, then it goes away. So what you need is basically a lot of antioxidants, okay? So what we have to fight this oxidative stress, and which omega 3 does, okay? So now, okay, if you look at the history of imbalance, when we were living with the nature. I think this all we always say that when we were living with nature, we were the best. The everything has happened after urbanization and commercialization, and especially in the last decades where there's lot of this processed foods, and I was surprised. I recently attended a wedding in Los Angeles, and our Indian Pandit in the Saat Feras was telling that the bride to take a vow that I will not order Uber Eats, and I was like surprised that what's going on. The Indian wedding system has changed, and the marriage vows have changed because traditionally we had this system where the women will take care of the house and cook and all, and now the trend of eating outside and processed foods have increased so much that has forced our pundits also to change things, anyways. But what I want to say is that the trend in India especially has changed. And if you look, I feel my concern is mainly the children because of the fast food culture and what is happening over there. I see a lot of kids because unlike the Western world where the children are on their own, I see that in cities, the Indian nurturing parents are nurturing the children almost till the college age, and so children have got lot free flowing funds, to go and experience all these fast processed foods, and it is affecting their health adversely because the ratio of omega 6 to 3 should be 3:1. This is where you want to be, okay? And they did studies and they found that most of the people are 15:1 or 25:1, okay? So I would really challenge all of you, even if you feel that if you're most healthy, to take this test when it arrives in India, because it is very important to know where you are, the imbalance between 6 and 3, okay? That is important to know what is your omega levels, and yes, D3. I feel that every person, including the doctors in India, most of them, because when we have our meetings, have vitamin D3. We have become tube-like animals, We don't get sunlight. Even in Bombay, the buildings are so tall. I see people doing Surya Namaskar, but actually they don't get to see the sun. They are seeing the next door neighbor, So that's the problem. We don't even get to see the sun anywhere, right? So vitamin D is a big problem. So all these things, when we do the test, as I told you that it is a very easy test. It is just a dry spot test. It is delivered at your home. Okay. So you don't have to visit any facility for this. If you're basically like working with a doctor, like for me, like what I'll be doing is that if I have my patients, if they cannot manage by themselves, I'll help them at my clinic. So same way, otherwise this test is very easy. Many of you do this blood sugar monitoring, or you just give a finger prick, then you have a drop of blood. Then this package, what you have, will be couriered to our office in Delhi. And from there, the Delhi office will take it to Vitas Laboratories, which is based in Europe. So, because what has happened is that this is a highly specialized test. And don't worry, many of you think, oh, what happens to blood? That blood dies and it cracks, and will my report be accurate? Don't worry about all these things, okay? Everything has been taken care of because this laboratory has done like more than 500,000 of tests, and they do from world over. It's a highly specialized lab, and people, I mean, the hospitals like Stanford, Harvard, all these things from UK, US, like everywhere they are referring to this laboratory, okay? So it is very much like scientifically great, and we don't have to worry about all those things. Now, let's talk about results. Okay, so there is a wonderful app which you get, and you can access your results online. Okay, so you will be getting your results online, and you will be knowing your ratio. Okay, that what is your omega 6 to 3 balance. As I told you, that normal should be like 3:1 or 4:1, but if you are having more, and then you will have to seek protection. Okay, and you can also track your progress. And as I told you, dear friends, this is something which is currently not available. In fact, if you are not a doctor, the fun thing would be you will be in fact going and maybe telling your doctor. Okay, so this is going to be fun. Okay, this information is very very vital and brand new in the Indian market. And as you have seen, I've always liked to be associated. I've always been the first to do everything. There was no concept of preventive cardiology in India, and I was the first one to get it. And Dr. Kalam was he actually encouraged me. It was a great meeting which I had where he encouraged me and like fueled my fire that helped the Indians without surgeries. Because that working without when not doing surgeries is like a very bold thing. In the medical profession. But I believe that nutrition and lifestyle changes is the answer to all chronic diseases. I completely support that, and I am also grateful to hundreds and thousands of my patients who have believed in me and trusted me. So I am again here coming up with something very remarkable, which I feel is going to change actually the way inflammation and we are approaching heart health in India.